Welcome back. Daily Show on a Tuesday, and it just doesn't feel like Tuesday today. That 3-day weekend does it to me every time.
Second Monday.
Yep. Right. Sometimes the 4-day weeks are harder than the 5-day ones, you know, and unless you have the recent recognition that you guys just received nationwide, and this is so cool. We have Lisa and Charlotte with us, and now Lisa, you're the Vice President and Chief Nursing Officer, and then Charlotte, the Director of Professional Practice and Nursing Operations. Fill me in on this recognition that you guys have worked years for. This is really cool. The top 8% of hospitals. Take me through this Magnet with Distinction recognition. What's the official title for it?
It is Magnet with Distinction.
Okay.
And less than, as you said, less than 8% of hospitals achieve Magnet, and even less achieve the level of distinction. So it's really an honor for us in this area to receive this recognition. And what it means is that not only did you exceed the stringent requirements to meet the Magnet designation, but you went over and above that and were designated as excellent in nursing care.
That's incredible. And now you were also saying, or we were kind of chatting before during the break, and that's that we were one of the only hospitals in the southern region, correct, in the southern part of the state to even have this, correct?
Yeah, and including the St. Louis area, right?
Wow.
So, we're really, happy and honored to do this. So we did this with 14 exemplars, and what that means is that in 14 categories, we went above the benchmark for nursing excellence and taking care of our patients and meeting all of our metrics and, providing excellent patient experience when the patients are in the hospital with us. So we went well above, and we're really raising the bar. So
well, and I'm sure, especially when you start talking 8%, and I mean, there's a lot of hospitals throughout the country, so 8% is incredible. And we were saying that 41.
Yes, we make the 42nd, and this is international and national.
Wow. That's honestly just incredible. And now take me through some of the, I guess, the overview, if you would, of those 14 exemplars.
Yeah, so I probably won't be able to remember all of them. But yeah, so our ambulatory services, so for patient experience, they outperform benchmarks in our safety for our patients, in caring for our patients, providing them with the education that they need. Same thing for our inpatient units. And really, sometimes they say, oh, well, you're a smaller hospital. Well, that even makes it harder for us. So we have, just a couple of inpatient units, which means that we have to outperform in greater than 51%. Well, when you have a couple of units, if you take one of those away, you really need to make sure that you do great work in every aspect of the hospital. So we also meet on our quality indicators. So we have not had an infection, a central line infection or a hospital-acquired infection for over 2 years in both of our ICU and our med-surg areas. So we're really proud of those metrics. So
that's incredible. Well, and honestly, it's one of those that for the folks that are watching this to know, just how, by the book and then some, you and your entire staff have to be, because if one person's not, in line with the game plan and the mission of the team, that's going to set you guys completely off track because of the smaller size of your guys' hospital. It could set you off track for all the work that you spent years trying to build up, and I think that's really important for the public to know too.
Yeah, it took us 3 years to get here.
Wow. That's incredible. I mean, that's just incredible for me. And now, when you get to this point, you get this recognition, which is huge. Is it one of those things where it's like, all right, let's celebrate for a couple of seconds, and because it's great, but now we got to keep going and keep maintaining this, I'm sure, too.
That's exactly what it is, because as soon as you get the designation, the clock starts for your next one, because it's every 4 years. You don't just get it and keep it.
Yeah. Every
4 years, we will have to meet the same criteria. And then they do change the criteria, right, Charlotte?
Yeah.
So you have to be able to, So we're already looking at what are we doing now? What do we need to add? What do we need to shore up so that we can continue this road?
Well, real quick, Charlotte, too, you were talking a little bit about just being with the distinction recognition, being the only one in this area, in the St. Louis area included with that distinction. What's the difference between general designation and then that designation with distinction?
Well, it just kind of really sets that level a little bit higher, right? So, we there's lots of hospitals that meet those criteria and become Magnet designated hospitals. But as I mentioned before, we've done that in 14 different categories, and we not only met the benchmarks, we surpassed them. So that really is what sets us above with that distinction. It just is a little bit harder to get. So, and we, like you said, we couldn't do this without all of the nursing staff being on board and being involved in their care of their patients and, everything that we have to do.
It's really fascinating. Well, and also, too, just to go a little bit more into the award and then also just the program a little bit, take me through the model. What is the Magnet model when it comes down to just the overview for the audience?
Okay, I'm going to let Charlotte go over because she's this is her wheelhouse.
Yep.
Oh, thank you. So really at the heart of it, like we've mentioned 1,000 times, is the patient outcomes. So the patient outcomes is the center of what the components of Magnet really mean. And with that, then we bring in transformational leadership. We have a great leadership team at Saint Anthony's that really just helps to set the bar for all of our nurses and really are great leaders. We also look at new knowledge. So as a hospital that has raised the bar, we now have to be innovative in the things that we do with our patients. So trying out new things, seeing what works. When we fall short in an area, we look back at the books and say, okay, what does the evidence of nursing show us and how can we do that? And then, our practice, our professional practice model and the nurses on the floor doing exactly what they need to do to make sure that they meet those outcomes. And then last is our excellence, just our structural empowerment, and that the nurses are able to practice at the top of their license and they make decisions that really impact their care that they provide for the patients.
Well, and speaking of nurses, again, talking before the break and how, great this is hopefully for you guys with, retaining and also gaining, new hires and new nurses that are out there, because the two area schools around here, it seems like, have some really great programs at SIUE and Lewis and Clark that really provide some good talent. And to have this, I'm sure, sets you guys a little bit above the bar, if you will, than some of the other area hospitals.
It does. And that honestly is how Magnet originated, because when the first nursing shortage hit in the 1980s,
Gotcha.
They found one hospital was doing really well in recruiting and retaining, and they called it a magnet because it pulled nurses. So that is how the designation started many years ago. For us, to your point, the first bar you have to pass is nursing engagement. So we have to show that our nurses are happy in what they do, they feel fulfilled, and as Charlotte said, and we say this a lot, that they're able to practice at the top of their license. So we have a group of nurses called the Professional Practice Council, run by frontline staff nurses, and they make a lot of the decisions about the work, about how the practice of nursing evolves and is done at OSF Saint Anthony's.
Well, I'm sure that's so important too, because especially with what the role is, especially with when it comes to ICU and ER nurses, the whole gauntlet of what your nursing staff covers. Morale and I'm sure just overall atmosphere is huge. And if everyone has a little bit more of that, not freedom, but also just more of that family mentality where we're a mission here, we're a team, I'm sure it really gets everyone across the finish line, especially because the hours and then just the different objectives and tasks that come in each and every day for the entire staff, I'm sure are a heavy burden sometimes.
Yeah,
very much.
Well, and now when it comes to the American Nurses Credentialing Center, is that who provides this recognition?
It is, and they are part of the American Nurses Association.
Okay.
So they're the credentialing arm of that organization. And so many of us get other kinds of certification through ANCC in our specialties. Charlotte and I both have it. Other nurses have it. Our frontline nurses have it in different categories. If you're a great med-surg nurse, you can do that. So they are constantly recognizing excellence in nursing in different levels and different areas.
Very fascinating. Well, and now too, whenever we're getting ready to take a quick break and we'll come back with more, but whenever we're talking about this, what do you hope the residents really of the region take away from this recognition the most? And to me, it's one of those where it's a really good breath of fresh air going, wow, it's not a health center that's having maybe some issues, because it could be a gauntlet. Financially speaking, it's been happening a little bit more lately, but for some great positive news, just to kind of reward a staff is huge. What's your thoughts just on that? How should they feel about it?
I think they should feel amazing. I think they should feel proud of their community, of the hospital that represents them in their community. I think that they should feel secure in the knowledge that when they come to OSF Saint Anthony's, they are going to get the highest level of care, and their outcomes are going to be better because the nurses are so engaged, and the nurses have demonstrated this high level of performance. I mean, it would be what would make me decide to go there.
Absolutely.
Oh, absolutely. 100%. It's 9:33. We'll take a quick break and we'll come back and talk more about this great recognition and honor for OSF Saint Anthony's Health Center. You stay there. Oh, by the way, only hospital with distinction in the area. Just want to throw that out there one more time. Just huge. 42 in the world.
In the world, yes.
Just incredible.
Yeah.
We'll take a quick break. We'll come back with more of this right after this quick one on Riverbender.
For the biggest selection of pre-owned cars, trucks, and SUVs in the Riverbend, visit AltonToyota.com or stop by their location on the Homer Adams Parkway in Alton. Winner of the prestigious President's Award, Magnet Designation, Alton Toyota knows how to treat their customers, and it will help you find the vehicle that is perfect for you. For years, Magnet Toyota has been a fixture in the Riverbend, and now Magnet Designation carries the tradition. New name, but the same great service you've come to expect.
Picture This and More has been a trusted name in the Alton community for more than 30 years, with the last 3 being right here on Broadway. We specialize in quality framing at affordable prices. We also feature works by local artists because we're proud of our community. If you have valued treasures to display and preserve, we're sure to have the perfect fit with our large selection of custom framing and display options. Whatever color, shape, or size, Picture This and More has the look you need. Stop by today and let us help you with your next project.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
And don't rock the jukebox. Wanna hear George Jones? 'Cause my heart ain't ready for the Rolling Stones.
Welcome back. In with Lisa in Charlotte, OSF Saint Anthony's Health Center. This has just been really cool. I love sharing positive news. You know, everyone always keeps getting the sad news, but when we get to talk about just this great recognition, this is so cool. And as we're diving back into this, you know, we talked about, if you're just tuning in, the significance of this recognition and the award. You're one of 42 hospitals in the nation. And, you know, it kind of is an interesting point, Lisa, because you were right. You're coming off the tail end of COVID a couple of years ago when you're starting this process. And the whirlwind, I'm sure that was for you guys in the healthcare system. And so to kind of start that in an interesting time, to say the least, and be able to come out looking like this 3 years later plus is got to be incredible for everyone that's in the front office watching this, but also for everybody that was on the staff that was, you know, making sure these pillars were met.
Yeah.
That's so cool. And now, as we go into this, what are some of the phases? Because you said that there's different portions of this, and I'm sure that each one of them's a little bit of a marathon in a way.
Yeah. So really, you know, back in August of 2022, when we submitted our application, click submit, that was nerve-wracking, right? So the process started. So it was really a lot of fact-finding. So when we say that there's magnet stories, there's things that we have to show. We have to demonstrate that, you know, our team has done certain things, and that is the process. So getting these stories, putting these stories in the right place, making sure that the right people were at the table, that kind of thing. That was really probably the hardest thing. You know, we all wear many hats, so, you know, that
right.
seemed to be the longest process. But the metrics were always there, so we always kind of, you know, made sure that, you know, our patient experience scores were on target, that our quality metrics were on target. And so that was the easy part, you know, just kind of riding out the storm. So when we actually then resubmitted the final document last August, it was kind of a wait and see, you know, so then we had to hear back from them and maybe make some adjustments to some of the things that we had, you know, let them know. But when they came in July and visited our hospital, it was just a validation of everything that we had told them in our document was true. And it wasn't that they wanted to talk to us, they wanted to talk to the frontline nursing
right.
staff, right? So So, they wanted to talk to the nurses that maybe had worked other places and come back to OSF and St. Anthony's because that is where they knew that was their home. So our surveyors numerous times heard those same stories of, somebody maybe going and working somewhere else, but realizing that this is really the place that they wanted to be. And that's really kind of our overall story of, just being a really big, great family there.
Well, and I think that's such an important part of it, because as a patient, you're only going to receive the best care from the folks that are feeling the best about the job they're doing. And morale's a huge thing, and just overall, atmosphere too. So to have your staff overall satisfied and everyone working the front lines and the emergency room and all the different aspects too, and just throughout the building and your nursing staff, it's great to know that, it's not, you aren't going to get a disgruntled, employee who maybe is just having a rough go of it. You're having somebody that's enriched in a really great atmosphere, and I think that's so huge. Mm-hmm. And, as we're going in, how many people were a part of the project team, if you will, for the...
Well, Charlotte led it. And Melissa Paletti, who unfortunately isn't here with us today, she partnered with Charlotte, and then they pulled the entire team together. We probably had all of our leaders touched it.
Wow.
All of our frontline leaders, our professional practice group touched it. And then when the surveyors came, I would say 90% of our nursing team touched this.
Wow.
They were there for 3 days, so they wanted to talk to every single person that walked in the door. They just have to validate everything that we've said to be true, and they did. So.
Well, and honestly, it seems like, and not seems like it is. Whenever what you guys are, and after you look at all the data standpoints and you submit your document, I'm sure there's nerves, but it's not oh my goodness, I hope nothing happens nerve. It's just all right, we're here. It's an exciting nervousness, because that you're behind your word, and your staff's going to be, as great as always. So it's a no-brainer when they stop in that it's going to be a great 3-day trip, And
I think that was the best part, is just seeing the nurses, like you said, engaged in everything that they do. And, we want them to do the process, not us. They're doing the hard work every single day out there with all the patients.
And that's the culture. And I think we've talked a lot about a lot of things, but the most important thing is the culture. You can work on putting things in place and getting outcomes and working on metrics. But one of the hardest things to ever have in any place is culture. Yeah. And the nursing leaders at St. Anthony's and all of the leaders have done such a great job in creating such a great culture. They commented on that several times. And I really think that is one of the things that catapulted us into distinction.
Well, I'm sure. Well, and also it goes into that, because I said it earlier before the break, but I mean, you guys have a very tough job. It's not, it's not mine where you get to vent into a microphone for 2 hours if you wanted to. I mean, you're working with folks and saving lives, and there's so much that goes into that. So to have an environment where everyone feels supported and we're all loving the team, I mean, that's really important. I'm sure in this industry it's hard to do, just because of all the different factors that go into the day-to-day job. And I'm sure that the satisfaction component is a tough part of that, and not necessarily because of a group of people or an admin or one policy, just because of the physical and mental demands that it takes to do this.
It's a hard job.
Yeah. Well, and now going back into this, so when was it decided that you guys were going to go ahead and pursue this? Was it after you kind of started looking at things and looking at those data standpoints, or were you feeling kind of like, what, we're feeling good about where we're at, just kind of overall and kind of internally, let's take a look at this and pursue it? What was that decision?
I think that the first part of it was seeing the nursing satisfaction scores.
Yeah.
So that kind of gave me the point of, wow, we really have some great satisfaction. That was probably the first 6 months that I was there. Mm-hmm. And then after we were able to really address some of those last issues with COVID and how the nurses really stepped in and made those things happen, I think that's when I really felt, and we really felt as a team, that this is something we need to do. Charlotte and I were part of another hospital that got Magnet Designation. Okay. So we kind of knew what to look for. And when we were seeing those things, we're like, we've got this. We need to start writing it, which, by the way, sometimes I think that's the hardest part, is the document they wrote, which would be this thick if we printed it out.
Oh, you can keep that. But it's really important to note that, too. And now that you receive it, like we talked about kind of on the front end of this, now we start the process again, correct?
Mm-hmm. Yeah.
And now, when do the changes, if there are changes that come into this rubric, when do you get notified of them? Is it during the process or is it beforehand?
You mean changes of like
the qualifying
yeah,
factors?
so I mean we look at that all the time. So that's part of our roles as leaders at the hospital. We're always looking at those metrics all the time, right? So we start our process, we start our clock ticking, and yeah, we can't get better than 0, but what if we do have a fallout? What if we, do that? We need to, go back to the drawing board and kind of like look and see where we can like make improvements, and that's part of being a Magnet organization is sometimes you do have rocky moments and things, or, metrics fall below where they need to be, but it's just a matter of how we look at it, how we change our practice to make everything better again.
Well, you're right, because I mean that's just part of life. You're always going to have something, but as long as you have a good team and you're staying focused, it's all all good. And when it comes to the pillars, though, that's what I was kind of curious about, because you said sometimes they might change up a different factor in those pillars. Do you guys get those kind of changes? Are they emailed to you, or do you have to kind of research it to figure that out?
Right now we're writing to the 2023 Magnet document. Right, so they change it every few years. I think before that it was 2019. Okay. Everybody wrote to that document. So there's just different levels of criteria.
But we're notified.
The document. Yeah.
Okay.
And so if they change it, they would let us know.
They'll let you know that you're writing to the new manual. This was we wrote to the new manual. This was the first year that the new manual was used. So we wrote to that, which was really interesting and much more focused on ambulatory than previously. Right. So it does change.
Yeah.
You always have to be getting better, but what doesn't change are those components of Magnet. Sense. So we can always look at our stories and look what we're doing, because those true north, that guides us.
Yeah.
Well, and before I let you go, just for all of you nursing students out there too that are maybe getting ready to graduate, or maybe you just graduated or you're kind of looking in the area, why not take a look at OSF? You guys have it. I don't know. You guys are never. Do you have openings?
We do.
We do have a few.
Yeah,
we do have a few.
Who wouldn't want to be? I mean, you guys are a Magnet destination, or
We have a place to be.
Yep.
We are the place to be. Yep. So on both sides, if you're a nurse or a patient. So
absolutely. And then just go to osfhealthcare.org to find out more, I'm sure, about those opportunities. But again, just congratulations on this. 42 hospitals in the world, and you guys are one of them, and that just says a lot about the overall staff. We'll take a quick break. We'll link everything in a write-up on RiverBender.com to show some more love. And also, I just want to clarify, I was going to put Lisa and Charlotte's titles in here, but I only have so much character space, and there was a lot of licenses going on.
That's nursing.
It's incredible is what it is. It made me kind of humbled, very 9:46, and we'll come back right after this one with the North Alton Godfrey Business Council. We're going to spotlight them and some of the great businesses in it.